Welcome to Suhail's Paramedical and Nursing Academy. Today I am going to explain about the hemodialysis. Actually, what is actually hemodialysis today? The topic that I am going to explain is hemodialysis. Remember one thing first, why we are going to do hemodialysis. Why we are going to do hemodialysis? In hemodialysis, we have to remember one thing, that we all know that when the patient is suffering from the kidney disease, first the patient will be suffering from the patient may be suffering from acute renal disease, or the patient may be suffering from chronic renal disease. Okay, so the patient can be suffering from maybe suffering from chronic or acute renal failure. So the chronic or acute renal failure the patient is suffering, remember, may lead to the end stage renal disease. When the disease is not treated, when the condition is not treated, when the acute renal failure or chronic renal failure, when they are not treated, they may lead to the end stage kidney disease. In end stage kidney disease, what happens? Actually, the 85 to 90% of the kidney function is being lost. So the 85 to 90% kidney function is lost in case of end stage renal disease. Now what will happen? The patient will not survive until we have to do either two. There are only two processes by which the patient can survive. Only two methods are there. One is, that is dialysis. In dialysis there is either peritoneal dialysis or hemodialysis, but this is a temporary method. What happens actually, if we are going for the permanent method, then we have to do kidney transplantation. We have to transplant the kidney. We have to take the kidney from one patient and transplant into the recipient. From donor to recipient, we have to do the transplantation as per the normal rule. So actually, but that is the permanent purpose. For temporary purpose, we are going to do dialysis. In dialysis, I will explain today in dialysis hemodialysis. In the next lecture or in the upcoming lectures, I will explain also peritoneal dialysis. But in hemodialysis, actually, what is hemodialysis? The hemodialysis is a process. I have written here everything definition. I will put the screenshot at the front of the video, of the front of the lecture, as well as at the last of the lecture. Some screenshots will be there, and you can write this after that, or with me you can write what I am saying. You can write in our own words. That will be more beneficial, because when we are writing anything by our own mind, by our own words, that becomes a permanent memory. Otherwise, if you write from any book, or if we study from any book or write from any book, this content we may forget. Okay, so what I am going to say, what is hemodialysis? Actually, what is hemodialysis? So hemodialysis is a process. Hemodialysis is a technique. Hemodialysis is a process. I have written here. Hemodialysis is a process of removal of nitrogenous wastes and excessive fluids from the body. So in body, when there is end stage renal disease, when 85 to 90% of the kidney function has been lost, there will be accumulation of nitrogenous wastes. Also there will be the excessive fluid within the body. That what happens? See, when there is excessive fluid in the body, it may lead to the edema, or what will happen? It may lead to the edema, and when the nitrogen wastes are inside the body, suppose urea or other nitrogen wastes, it may lead to what? It may lead to encephalopathy. So there are the brain disease conditions. So different conditions of disease may lead to the patient, and ultimately there will be the death of the patient. So what we will do? We will do the removal of the purification of blood by removal of the nitrogen wastes as well as excessive fluid. The process is called as hemodialysis. I have written here. And in hemodialysis, what we have to do? We have to do first the vascular access. Vascular access means we have to find the vessel. We have to find the vein where we are going to do the hemodialysis. If the patient is if there is immediate need of hemodialysis, or if the patient needs hemodialysis for one time within a week, one time within a month, that means for rare cases, if he needs hemodialysis rarely, for that, then what we are going to do? We will do immediate vascular access. Immediate vascular access, we will directly insert the catheter into the internal jugular vein, or the vein that is coming from the heart, that is subclavian vein, the vein near to the heart, subclavian vein, the either the internal jugular vein, either the subclavian vein that is near to the heart, or the femoral vein that is present at the thigh. So these three veins we can use for the immediate hemodialysis. Remember one thing. So if the patient is coming and this patient needs hemodialysis, if the patient needs hemodialysis for what? If the hemodialysis needs hemodialysis per day or 6 times in a week, that I will say there are types of hemodialysis. I will tell this also. That is conventional daily hemodialysis, nocturnal and continuous renal transplant therapy. In conventional hemodialysis, we need hemodialysis 3 times a week. Conventional, that is by convention ways. Another is daily. Daily means six times a week, 6 days in a week we need hemodialysis. Another is nocturnal. Nocturnal means 6 times in a night, 6 nights in a week, 6 nights in a week we need hemodialysis. That is nocturnal hemodialysis. And some patients need continuous renal replacement. Some patients need continuous renal replacement therapy. That means continuously 24 hours there will be hemodialysis continue. And remember the thing that these are the types. And in this case, suppose there is a daily hemolysis. In case of daily hemolysis or in case of continuous renal replacement therapy, continuously we have to do the hemodialysis. For that purpose, we will go at permanent method because every time we will not put the catheter into the internal jugular vein. Okay, so we will use any permanent method. There are two methods, either AV fistula or AV graft. Internal AV fistula or external AV fistula. Internal means surgically we will first surgically inside we will put AV fistula, or externally AV fistula we will put, that is external AV fistula. Another is AV graft. AV graft, what are these? See, AV fistula and AV graft we are using for what? I told when there is the continuous need of hemodialysis. So AV fistula we need, what happens? Arterioventricular fistula. Artery and vein will be joined, surgically joined. That is also called as anastomosis. The surgical anastomosis of the vein as well as the artery is called as fistula. So why we are doing this? Another is, this is AV fistula. Remember the thing. I will tell the reason later also. Another is AV graft. AV arterioventricular graft. Here artery and vein we are joining each other. That is cephalic vein and radial or brachial artery we are joining each other. We are doing anastomosis of these two veins. And this is what is this? This is called as AV fistula. And this AV fistula matures in 6 weeks to months. So it takes 6 weeks to months to mature. After that we can do hemodialysis. So that is why this we cannot do at the immediate. If there is immediate need, we should not do this. At immediate need, we have to take the immediate vascular access that I told before. That is direct putting the catheter into the vein. Another is that is called AV graft. AV graft means artery and vein we will join each other, not directly but by means of a graft. The graft may be a cow carotid artery. The graft may be a cow carotid artery, or the graft that we are using is made up of maybe artificial, that is made up of silicone or made up of polytetrafluoroethane, PTE, polytetrafluoroethane. So this is that is artificial graft. So why we are using the graft, and why in case of permanent metal, why we should use these methods? If the vein is weak, if the vein is not weak, if the arteries are not weak, if the vascular system is not weak, if the veins and arteries are not weak, and we can easily put the AV fistula, and the veins, if the suppose cephalic vein and radial artery, if they are not fragile, if they are not weak, we can use AV fistula. So we can connect these vein and artery each other. But what happens if the vein is weak, if the vein or artery is weak, what we should do? We have to do AV graft. AV graft externally we will join this. So we will not directly join this artery and vein because it is a weak. So for weak purpose we will use graft. Graft may be a cow carotid artery that I told. So these are the two methods in case of permanent. If there is permanent need of fistula for using fistula. Why we do this fistula? Why we are doing this anastomosis. What is the need of AV fistula? What is the need of AV graft? Remember, what will happen? The blood that is entering into the vein, when we are doing the anastomosis, the vein from artery will also enter into the vein. See, the blood of artery will also enter into the vein, and this vein will dilate. There will be increased pressure within the vein, and this will make the hemodialysis easy, as well as the blood flow will be easy towards the dialyzer. And another reason is that the main reason is that this blood from artery will go towards the cephalic vein, so that it will take less time for hemodialysis. So it will take less time by means of this method. All the blood will go towards the vein. There will be high pressure with the vein, so it will make a vein potent for hemodialysis. So more blood will be coming out and entering to the vein. So that is why we are pushing this into the. So, and I will tell here the complication I will tell in the later, but in the complication that I will tell in the later, I will tell the complication here, not at the later. Remember the complication, you can write at the later what is the complication, but here I will tell. Suppose when the blood is going to the vein, what we are doing, we are pushing all the blood towards the vein, but because we are doing the anastomosis, we are joining artery and vein, the blood that enters in the vein, remember, all the blood will enter the vein, and from vein it will now artery, because artery transfers the blood towards the what? Towards the hand. Brachial and cephalic artery. There is cephalic artery and radial artery, we have joined each other. When we have joined this cephalic vein and radial artery, what will happen? The blood that is coming back from the artery, remember, will come back, but the arterial blood will go towards the hand. So when we are doing anastomosis, this arterial blood will go towards the vein, and from the connection itself it will come back. So this hand will not receive the blood, arterial blood. That syndrome is called as there will be the formation of one syndrome. That is what I was saying, that is anastomosis. So after anastomosis, AV fistula and AV graft putting, I was explaining about the hemodialysis apparatus. In hemodialysis, the dialysis apparatus consists of dialyzer. The dialyzer is also called as artificial kidney. Another is dialysate. Dialysate is the solution that we will use for the removal of the nitrogen wastes from the blood. Another is dialyzer, artificial kidney, also called as artificial kidney. Another is dialysate. After dialysis, inside the dialyzer there will be the semi-permeable membrane. See, I will explain here. This is called dialyzer. The machine is called dialyzer, and inside dialyzer there will be the thousands of tubules which act as a semi-permeable membrane. And there will be the fresh dialysate solution. Fresh dialysate solution will be made up of two parts. Part 1 and part 2. In part 1, what happens? In part 1 there will be potassium chloride, sodium chloride, magnesium chloride, glucose monohydrate. In case of part 2 of fresh dialysate, there will be bicarbonate powder which is mixed in the 9.5 liter fresh water. So this is dialysate. This pure dialysate will enter into the dialyzer, and here will be patient's blood is coming from this side. Patient's blood is entering into the dialyzer. In dialyzer there is semi-permeable membrane, and the nitrogen waste which are present in the blood will pass through semi-permeable membrane, as well as the excessive fluid will pass through semi-permeable membrane by means of three principles. Those principles are diffusion, osmosis, ultrafiltration, that I have explained in these topics. You can see I have already explained diffusion, osmosis, and other transport across the cell membrane. You can see these three principles work here. So in these thousands of tubules, what will happen? The nitrogen wastes and the excessive fluid will enter into the dialysate fluid. So the dialysate fluid was entering this side, and after removing the nitrogen waste, after taking the nitrogen wastes of blood, it will be removed from the another side, that is dialysate with waste. This was fresh dialysate. So here semi-permeable. Remember, semi-permeable membrane means the membrane the semi-permeable membrane can be defined as the membrane that will allow solvent only across it, but not the solute. Here it will allow solute also. That is why it is not a pure semi-permeable. Remember, there are the nitrogen wastes can also enter through semi-permeable membrane towards the dialysate solution. The dialysate solution will remove it, and also inside there will be a automatic BP cuff. that is connected with the dialyzer, this dialysis apparatus, that will also measure the BP of the patient during the procedure, and heparin infusion pump will be there also connected. Why heparin infusion pump is connected? Remember, it will produce the heparin. The heparin infusion pump will give heparin towards the blood. When this heparin will enter the blood, it is an anticoagulant. It will act as an anticoagulant. So it will not allow blood to clot. So there will be no clotting. So it will prevent clotting mechanism. So the blood will not clot. That is why heparin infusion pump is there. And a blood pump is also inside the hemodialysis machine. That blood pump will pump the blood towards the body and from the body. Okay, this is the diagram that I have told, as well as the parts in the hemodialysis machine, and this is the AV fistula, AV graft, and I told indication. Suppose I told indication is when 85 to 90% of the kidney function has been lost. In case of this condition, what will be the signs and symptoms? What will be the signs and symptoms by which we can feel that kidney 85 to 90% kidney, the function 85 to 90% kidney function, the 85 to 90% of the kidney functions has been lost. How we can know? Remember, there are indications. One is A. I have made see here AEIOU. A means AEIOU. A means acidosis. There will be the condition of acidosis, and E means there will be the condition of high electrolytes in the blood. So high electrolytes will be in the blood. A means acidosis will be there. That is acidosis. So acidosis, what is acidosis? I will explain in the ongoing lectures. I will explain what is respiratory acidosis, what is respiratory alkalosis, what is metabolic acidosis, what is metabolic alkalosis. That will be also explained in the ongoing lectures. I means what? Injection of drugs. If the patient has ingested some drugs, suppose for heart failure, or we can say there is a drug like salicylate. The salicylate drug, if patient has taken, we will do hemodialysis. O means fluid overload. There will be the overload of fluid also. If there is overload of fluid, we need hemodialysis. And this was the indication. This was the indications. And U means there is uremia. If there is uremia means there is high urine in the blood, excessive concentration of urine in the blood. Because in the blood there are also present nitrogen wastes are always present in the blood, but in a normal concentration. When the kidney lost its function, all the nitrogen wastes will accumulate within the blood. So then there will occur uremia condition also. Principle I told, diffusion, osmosis and ultrafiltration will work here. And what are the types? What are the types of hemodialysis? There are 4 types of hemodialysis. One is called as conventional hemodialysis. Here, conventional hemodialysis means we are doing the hemodialysis 3 times per week. Dialysis, daily hemodialysis means daily. Daily hemodialysis means we are doing the hemodialysis daily. That means 6 times in a week. And this daily hemodialysis is done for 2 hours. Okay. Nocturnal hemodialysis we are doing the 6 nights per week. 6 nights per week we are doing the hemodialysis, and this nocturnal hemodialysis is done for how many hours? 8 to 10 hours. And another is continuous renal replacement therapy. Continuous renal replacement therapy means 24 hours it will be done. 24 hours hemodialysis will be done for the patient. Another is contraindication. For which patients we should not do. Remember, contraindication I have put here all the contraindication. You can screenshot. I will use a screenshot at the first of the video and last you can see. Contraindication means where we should not do the hemodialysis. Remember, if the patient is having hypotension, reduced BP, remember we should not do hemodialysis. If the patient is having abnormal vital signs, we should not do the hemodialysis, because suppose if the BP is reduced, that means hypotension, so we should not do the hemodialysis. If the patient is facing of hypovolemia, don't do the hemodialysis. That is another condition. Another is coagulopathies. Coagulopathies means if the patient is suffering from clotting disorder, if there is chance of clotting when we are doing the hemodialysis, if there is any clotting disorder, what are the coagulopathies? What are the clotting disorders? Suppose the clotting disorders can be hemophilia. It can be hemophilia, or it can be any other genetic disease that leads to the clotting, that leads to coagulation of the blood. In case of hemophilia, there will be no coagulation, but in case of coagulopathies, there is condition of blood clotting. So hemophilia is different, coagulopathy is different. Hemophilia, there will be excessive loss of blood, that is bleeding, that is also called as bleeding disorder. But here will be coagulopathies. Coagulopathy means there will be the coagulation The coagulation may occur in the patient, that is coagulopathies. So it is opposite to the hemophilia condition. Extremely low cardiac output will be there. If the cardiac output, I have told already, what is the stroke volume, what is cardiac output. The cardiac output means how much blood the heart is pumping out per minute is called as cardiac output. When the cardiac output is reduced, means there is less blood within the patient is not having the adequate blood. The fluid volume with the patient is very less. For then we are doing what? We should not do hemodialysis for that, for those conditions also. Another is what? And this was another is complications. I told you complication is there may be due to the AV fistula there are chances of infection. Complication is there are chances of infection. In case of AV fistula there are chances of infection. In case of AV fistula there are chances of what? There are chances of infection is main thing is infection. Another is I told steal syndrome, arterial blood steal syndrome. So the blood will not reach towards the hands, that will cause the syndrome that is called arterial blood steal syndrome. Okay. Another is that this was all about the hemodialysis, and this was the what are the contraindications, and what are the complications that we face after the hemodialysis. Remember, during the process of hemodialysis, before the process of hemodialysis and after the process of hemodialysis, what is the nurse's role? What nurses have to do? Remember, the nurse's role, the first rule is we have to check the vital signs before and after the procedure, and during the procedure also we have to be careful. Remember, we have to check the bleeding. If there is any bleeding during the procedure, we have to be careful. If there is any twisting of the leads within in the dialysis machine, so we have to be careful for that also. And remember one more thing, that if the patient, after we have to check the lab values. After the lab, we have to go for the blood analysis before and after the procedure. We have to check the electrolyte content within the blood. We have to check the RP1, RP2, or the analysis that we are going to do, or the profile that we are going to check in the labs, that we have to do before and after the procedure. We have to also check. And if the patient is taking antihypertensive drugs, remember we have to hold the antihypertensive drugs also. And after the procedure of hemodialysis, if the patient is not having the adequate vitamins if the patient need vitamin therapy, we can give vitamin tablets to the patient after the procedure. And remember, during the procedure we have to see the thrill or brute sound. If there is thrill or brute sound at the site of fistula, or at the site of connection with the hemodialysis machine, so we have to see there are abnormal sounds like thrill or brute sounds. We have to also check that. So this was all about the hemodialysis. Once more, 1 second. So once more I will tell this in a simple way. I will tell once more why we need hemodialysis. If there is 85 to 90% of loss of kidney function, we need hemodialysis. This occurs in case of end-stage renal disease. Remember this point. What is hemodialysis? Hemodialysis is a process of removal of nitrogen wastes as well as excess fluid from the blood, and this process is called as hemodialysis. Remember, and this is actually a purification of the blood. And in this we are using a dialysis apparatus. The dialysis apparatus consists of dialyzer, also called as artificial kidney, which consists of which is having the semi-permeable membrane is inside it, and the semi-permeable membrane inside it. The three principles act for the purification of blood, that is diffusion, osmosis, and ultrafiltration works within the dialyzer. So dialyzed fluid is also there, that is coming from one side and going another side and removing all the wastes from the blood. And dialyzed fluid is of A part. There are two parts, A and B part. What is the content of A and B? I told here. And there is this semi-permeable membrane will remove the excess nitrogen waste as well as the fluid by. So this was the types, and then I told you contraindication why we should not use when we should not do the hemodialysis. In what cases contraindication? Coagulopathy, if there is clotting disorder, if the patient is facing if the patient is suffering from any coagulation disorder, that is coagulopathy. Hypotension, if the patient is suffering from decreased blood pressure, that is hypotension. If the patient is suffering from extremely low cardiac output, if there is extremely low cardiac output, for those cases also we should not do hemodialysis. That was the contraindication. Nurse's role, I told already what nurse will do. If there is need of vital sign, we have to check. We have to see the any bleeding is not there, any bleed. We have to check the lab values, vitals we have to check. Weight, we have to check of the patient. Before and after the procedure, we have to check the weight of the patient. Bleeding, if there is any hypovolemia or shock. Remember, after the hemodialysis done, if we have to check the fluid or hemodialysis, there should not any volume hypovolemia condition is, if there is any hypovolemia condition, we have to check that. And hold, we have to hold the medication like antihypertensive hyper antihypertensive drugs that we are using for that patient. Remember, if the patient is taking digoxin, that is which is used for the cardiac disease, the digoxin drug we have to hold for the patient. And remember, if there is abnormal sound like thrill or brute sound in the patient, we have to be careful. This brute or thrill sound will be present at the AV fistula or AV graft, or where we are using the immediate vascular access. Okay, so and I told them what are the complications will be. There will be this arterial blood steal syndrome. There will be the blood steal syndrome, arterial steal syndrome. We can say arterial steal syndrome. In this condition, what will happen? Blood will not reach towards the extremity where we are using the AV fistula. As well, there are the chance of infection in case of AV graft and AV fistula. And other than infection, there are chance of coagulation, blood coagulation are also chances. There are chance of bleeding. There are chance of bleeding also in the patient. And remember, in case of patient also there are chance of hypersensitivity or there are chance of hypovolemic shock. So these are all the complications that may occur in the hemophilia in the hemodialysis. In the next lecture I will explain peritoneal dialysis, or if there is anything remaining in this I will tell also that. Thank you.